introduction. I'm also happy to be here, and just to attach a face to a name, that's me. Hi everyone, and I'm going to keep my video off for purposes of connectivity. As introduced, I'm going to be talking about COVID and how some of the work that we've been doing with people that are living with HIV relates to this period that we've had the pandemic, especially within Zambia. So that's my title there. I'd like to first start by making this statement that this work was actually done in 3 countries. But what I'm going to be looking at today is specifically for Zambia, although some of the issues might overlap between Zambia, Brazil, as well as the UK. But my focus really is just to isolate some of the issues that came out from the Zambia material. So this work was done around May, June of 2020, and we did some follow-up interviews for the Zambia part. We focused on 20 participants. We had 10 females and we also had 10 males. And these were all people that were living with HIV. An interest really for this work was to sort of explore how living with HIV in the COVID era has changed or transformed itself, and we're interested in the stories, the experiences, as well as even perceptions of how COVID-19 was affecting the lives of these individuals. Now, I must say also that this group of participants is a group that we've been working with or talking to, I think, from 2018. So we tried to compare the stories from the 2018-2019 Global Challenge Research Project, but also just to see whether there are some changes as a result of COVID. Now, for Zambia, just some statistics around COVID. As of 22nd April, we have had cases of over 300,000, and the death rate stands at 3,975. And for a country which has a population of 18 million, I think that's quite high. But within Africa also, we see a number of cases, 11.4 million cases with over 252,000 deaths. So that's just a picture of what we are dealing with in terms of COVID and how it has affected the continent, but also Zambia. Now, those of you that are here and participated in the session that we had some time back, I think some of the methodological issues that I highlighted were also applied on this particular study that was done in 2020. Again, it was a question of us engaging into a dialogue with the participants, and for data collection, our interest really was on the stories, the telling that these participants had to share. Again, like I said, it was people living with HIV, and it was more theoretically grounded. Our work was grounded in therapeutic citizenship and this idea of decoloniality. And the approach that we used in terms of analyzing the material was really a combination of what I would call a thematic approach, but also a narrative thematic analysis, as highlighted by some of the scholars that have written on this approach, especially when you're using interviews. So focus was much on what was being said, the content of the narrations or the stories that the participants were sharing. Again, here, I think the issues were around focusing on some of the agency issues, the subjectivities that these participants were narrating. But it was also a question of looking beyond what was being said and looking at the creations or constructions, even deconstructions of the expressions and narrations that the participants were giving out. For example, within the material, within the stories, was there anything to do with social identity? Or was there anything to do with group belonging, collective action? So I have two cases which I'll later on share, and we'll see some of these things emerging or coming out from the material. And it was really a question of making a link between the lived experiences of these participants and also the power relations or inequalities thereof. So an exploration of what was common across all the transcripts leading into a process of coding around participants' experiences as it relates to inequalities is something that we were interested in. So I've got two cases with me. There's case one here. This is an extract from a very long script of one of the participants who we have given I would say a fake name. So this participant by the name of Sivo, of course, this is a pseudonym, has had this to say in relation to how COVID has really changed or how things have changed as a result of COVID, especially given that she was living with HIV. So what we see here, I'll just pick a few things. What we see in this script is that there was a bit of rationing that was happening. So ideally, people that are living with HIV in Zambia are given their medication for 3 months in advance. They stock. But when COVID came, or when COVID was reported, when cases of COVID started increasing, the clinics or the health facilities sort of started rationing on the medication. So they'd give people drugs for 6 months and not the usual 3 months. Now, from standing from outside, you'd think 6 months is okay, but the challenge with the 6 months rationing, based on some of the reports and stories we got from the transcripts, is that some of the participants actually were getting medication that was expiring. So if they are given 6 months medication, that medication will not last 6 months because it will expire maybe within 4 or 5 months. And so that created a problem. And the issue of, as you can see, visitation was restricted. You can't go to the clinic whenever you feel like, or if you've got a health issue, you've got to go every after 6 months. Now, for some time not to have an appointment with a healthcare personnel or a doctor. So in this case, we see that from the narration, we see a lot of restriction on medical checkups. It is mandatory, at least for people that are living with HIV, or a requirement for them to know their viral load, their CD4 count, but all these were not possible. There's an expression here where Sivo says, weeks ago, I was not fine, was scared to go to the hospital. Now, again, this fear of going to the hospital relates much more to the COVID situation, that now it was not conducive for someone to go to the hospital because of COVID. So we see people are now anxious, according to her. Then there's an economic part here. Prices of commodities are going up. Small businesses have been affected. And then there's also an issue of work here. Siwa says before COVID, she was selling, she used to sell food items, but now no one is buying. So there's a link here between the source of income that these participants or this participant was conducting, but because of COVID, the sales went down or were actually non-existent. Again, in terms of how the pandemic is being managed, I think this participant links HIV to COVID by saying how HIV was managed. Maybe there can be lessons that can be picked from how HIV and AIDS, especially in
Hi everyone, have we lost sound?
Earlier stages, particularly before bring those lessons into the COVID. I'm back now. Am I back? Hi, Corinne.
Hi, yes, you are back, I think.
Oh, sorry. My network is tripping. So ideally, this script or this extract really points to a number of things: the psychosocial issues, the mental health issues, the economic issues, but also the medical issues. So I'll move on to maybe the last thing that is actually interesting here, as you see in the themes that were generated from these stories, is the issue of so many cases of RT defaulters and also people with low or weak. So because of COVID, there was a sense or a feeling that there would be a lot of people that would stop taking their medication, the antiretroviral treatment, and also a lot of people develop what this participant called weak immunity. In case 2, this is a female. The issues are almost the same. What we see is a restriction in the medical attention, not having an appointment with
I think we have a blip in the audio again, is that right?
A doctor, even when, because then, oh, sorry.
No, it's okay. We're good.
My network is, okay. So in this second case, we see almost a similar account of the issues, the medical issues. We see the restrictions in how many times someone can go to the clinic. You can't have enough time with the physician. Maybe you're given a few minutes. And also the issue of government trying to take control of the situation was related to the issue of limited resources. And I think this is a finding that will later be explained a little bit more. Again, we see that social interaction was a problem because then, according to Molilo, this participant talked about, we used to interact as people with HIV and share knowledge, but now we can't due to COVID. So the coming of COVID disrupted the social interaction that used to happen among us people that are living with HIV. So the whole lot of this script, or the previous script for civil, they all speak to almost similar issues. But I'm also interested in one thing here where this participant says people will keep fearing the COVID. So this is post-future expressions. COVID is still there and will not be able to go to the health facility. This crisis will make us as people and nations to plan ahead and be prepared for such disasters in future. So we see a level that maybe health care systems are not prepared for something like this. And this is not just a Zambian issue. I think it's across even the developed nations that the COVID situation just reviewed how unprepared health systems were. Now, so what do the cases tell us? Of course, those were just 2 of the 20, and there were extracts from a very long script. There are 3 things that really come out from the scripts. The first is that living with HIV or living a positive life within the context of COVID had a lot to do with treatment issues, testing, and I think that people were not able to test in some health facilities. There were issues of, psychosocial support, NGOs helping in some instances, handouts, some non-government organizations that I know were really giving out some food to some of these people that are living with HIV and have lost their jobs or source of income. The second point from the stories is that there was a very common idea that life was just hard, for a lot of these participants, especially that they are living with HIV and then COVID came through. So we see that people losing their jobs, like that in that example of Sivo, she used to sell, but because there's no one to buy, it became a disruption in terms of the income flow. For those that were living at a distance, and again, for so many of these participants, due to stigma, they would rather go to a health facility that is not within their residence. So it meant that there's an issue of transport poverty, as if we were to call it that way. Mobility was an issue, but within that, the government was trying its best with limited resources. There was no bailout for these participants, at least from the stories that we got. What we got was that a lot of them had help from the church and NGOs, like I earlier mentioned. So within the life is hard expression, we can note that I think it's more of a line, a narrative expression or line that links poverty to lack of food, lack of transport, and in some instances, those that were living in rented houses could not afford to pay for those houses anymore. So this was an issue that was mentioned across all the participants as the stories. In terms of looking to the future, of course, there was hope. Others talked about capital, having a better education, business, and having a job so that they can help other people who are also living with HIV. Again, like I mentioned, within the narrative interest of this work, it was about what collective ideas are coming through. So there was a lot of usage of the word we, which really can denote a sense of collective action, especially as it comes to possibilities. Now, the inequalities that were identified within the stories were many, and I think these experiences, like I mentioned earlier, overlapped across some of the issues that were noted as being difficult. For example, the issue of lack of income or a job. So again, depending on the locality, sometimes the age, even the gender of the tellers themselves, the storytellers, we saw that there were inequalities that were experienced at different levels, but more importantly, the power or the interest to illustrate some of these inequalities came in a very collective way as a way of countering some of the challenges that were being faced as a result of COVID. So family support, NGO support, church or religious grouping support, all these were part of the countermeasures. From the government, there was limited intervention apart from provision of ART, but not necessarily bailing out individuals.
Sanny, could I ask you to wrap up fairly soon?
Sure. All right. Thank you, Corinne. So we have generally within the stories health inequalities, issues around economic challenges, mental health issues because of the social isolation. People were not allowed to to gather, and as a result of that, there's a lot of isolation which affected some of the individuals' mental health. Again, issues of using telephones, to phone a GP or a doctor, all those were difficult. Getting information around what exactly COVID is, there's a lot of misinformation, of course. So there's, again, a gap between information sharing. Let me end by saying that when dealing with stories of this kind, I think it's very important to look at what sort of representations are coming out based on what I would call poverty HIV discourse. That we need to isolate the vulnerabilities, but even within vulnerabilities, it's also important to look at the countermeasures of these challenges that are being faced. And there were a lot of them, like I mentioned, family support and so on and so forth. And also the mention of government and the intervention that government has had, or the lack thereof, relates to these political issues. But beyond that, it was really listening and thinking through each and every word that these participants were giving us. There, of course, intersections across the themes, but what was important was the issue of agency, the constructions or deconstructions that were either social, economic, cultural, and even political. So for the participants generally, I think this was an opportunity to have someone to talk to and share their challenges, especially within the COVID era. I think it was empowering in a way. I thank you.
Sanny, thanks